And so in COVID, it's been, there's many layers that we need to use sort of as different tools. Just because vaccines are out there doesn't mean that masks stopped working. And in fact, none of these measures are 100% safe. So, I think the future that we have is a future where it's not going to be the government imposing upon you and saying you must wear masks everywhere. It's going to be more of an individual decision in a lot of ways. And people are going to have to make decisions about, well, if I'm outdoors playing soccer or something, is that risky? No, it's probably not, because being outdoors, we know, is very, very safe. But if I'm an employee in a kitchen in a restaurant where the ventilation is very poor, and I know there's 3 or 4 people around me that aren't vaccinated, that's a much riskier situation. And so using tools, not just using one and not the other, but using both, I think is a really good idea. And part of the reason the WHO recommended that is because we do now know that the Delta variant is twice as infectious as the original COVID that came. And just to make this an anecdote about it, the attack rate within households early on last year was about 30% or so. So you'd have, a family of 10 living in one house, you'd have 3 or 4 people get infected. And what the initial outbreak in India, when it was just going really crazy over there, everybody in the house was infected. And all the physicians were saying this is unlike anything we ever saw because it was just so infectious. Everybody in the house was getting infected. And all the data has really held that up, actually. So because it is so infectious and because no vaccine is perfect, why not add 2 very, very effective interventions together to protect yourself?